Hello, everyone, and welcome back. Today, we are diving into a question that comes up constantly across sexual health education, medical practices, and private conversations. Is anal sex safe or unsafe for both men and women? There is a vast amount of misinformation out there. On one hand, some sources portray anal sex as completely dangerous, claiming it leads to inevitable physical harm or long-term damage. On the other hand, mainstream adult media often depicts it as an act you can jump into instantly, with zero preparation, lubrication, or anatomical awareness. The medical reality sits right in the middle. Anal sex carries distinct anatomical risks for both men and women, but when practiced with proper medical protocols, high-quality barrier methods, correct lubrication, and physical pacing, those risks can be significantly minimized. In this episode, we are going to break down the complete comparative science of safety. We will explore how male and female anatomy differ during anal play, short-term and long-term medical risks, STI transmission dynamics for both genders, and the universal safety rules everyone needs to follow. Let's begin by looking at the core anatomical structures shared by both men and women, as well as the key differences. First, what is identical in both sexes? The rectum and anus in both men and women are anatomically built for elimination, not penetration. Unlike the vagina, the rectum does not produce natural sexual lubrication under arousal. Furthermore, the lining of the rectum, the rectal mucosa, is composed of a single layer of delicate columnar cells, making it far more fragile than external skin or vaginal walls. In both men and women, the opening is secured by two muscular rings. The external anal sphincter, which is under voluntary conscious control, and the internal anal sphincter, which is controlled by the autonomic nervous system and only relaxes when it receives gentle, steady pressure and the body feels safe. Now, where do men and women differ anatomically during anal play? For men, the primary internal organ stimulated during receptive anal play is the prostate gland, often referred to as the male P-spot. The prostate lies directly against the front wall of the rectum, roughly 2 to 3 inches inside. When stimulated through gentle pressure, it can produce intense physical sensations and even ejaculatory orgasms without direct penile stimulation. For women, the primary internal structure engaged is the internal clitoral network. The clitoris is not just in external glands. Its internal arms and erectile tissue wrap around the vagina and sit in close proximity to the anterior rectal wall. Deep pressure in the rectum indirectly stimulates these internal clitoral tissues, as well as the dense pelvic nerve network. Now, let's address the core question. What makes anal sex unsafe if precautions are ignored? Because rectal tissue is thin and unlubricated, friction without adequate lube creates microtears easily in both men and women. These microtears are often painless, but they create a direct pathway for pathogens to enter the bloodstream. Let's look at the primary physical risks for both genders. Risk number 1, anal fissures. A fissure is a small tear or crack in the lining of the anal canal. It occurs when penetration is forced before the sphincters have opened. Fissures cause sharp pain during bowel movements and minor bleeding. While most heal with rest, chronic fissures can require medical intervention. Risk number 2, hemorrhoid flare-ups. Hemorrhoids are swollen blood vessels in the lower rectum. While anal sex does not create hemorrhoids out of nowhere, friction can severely inflame existing internal or external hemorrhoids, leading to pain and bleeding. Risk number 3. Rectal perforation. This is an extremely rare but life-threatening emergency. It occurs when excessive violent force or objects without a flared base puncture the wall of the rectum, requiring emergency surgery. What about long-term damage or fecal incontinence? Medical research shows that consensual, gentle, and properly lubricated anal sex does not cause clinical fecal incontinence in healthy men or women. While temporary muscle relaxation occurs right after play, the sphincters return to their normal baseline tone. Incontinence risks only stem from severe physical trauma, chronic forced penetration, or unmanaged tears. Now, let's examine STI transmission and gender-specific health risks. Receptive anal sex, whether performed by a woman or a receptive man, carries the highest per-act transmission risk for blood-borne and mucosal viral infections, such as HIV, hepatitis B, and human papillomavirus, HPV. This is due to the single-cell layer of the rectal lining and its high concentration of blood capillaries. For the insertive partner, the partner penetrating, risks include bacterial infections such as urethritis, chlamydia, or gonorrhea entering the urinary tract from exposure to intestinal bacteria like E. coli. However, there is a major gender-specific risk unique to women. In women, the urethral opening and vaginal canal sit in very close proximity to the anus. Moving a penis, finger, or toy directly from the anus into the vagina transfers intestinal bacteria straight into the vaginal environment. This frequently results in severe urinary tract infections, UTIs, bacterial vaginosis, BV, or kidney infections. So, how do we make anal sex as safe as possible for both men and women? Here is the complete harm reduction protocol. Protocol number 1, the one-way street rule. Never switch from anal penetration to vaginal or oral penetration without a complete barrier change or thorough washing with soap and warm water. If using a condom, take it off and put on a fresh condom before moving to the vagina. Protocol number 2. Silicone or high-viscosity water-based lubricants. Never use saliva. Saliva evaporates rapidly and introduces mouth bacteria into tissue microtears. Use high-quality, long-lasting silicone lube or thick water-based anal lubricant, reapplying frequently. Protocol number 3. Avoid numbing sprays and creams. Desensitizing agents shut off your body's pain signals. Pain is an essential warning mechanism. If you cannot feel pain, you cannot signal your partner to slow down, dramatically increasing the risk of serious tissue tearing. Protocol number 4. The flared base rule for toys. The rectum produces natural involuntary muscle contractions called peristalsis. Any toy inserted into the anus, for both men and women, must have a wide, rigid, flared base. Smooth objects without a base can be pulled upward into the colon, requiring surgical removal. Protocol number 5. Protection and preventive care. Always use condoms for anal play unless in a mutually monogamous relationship with recent STI screenings. Receptive partners should also consider discussing PrEP for HIV prevention with a physician, as well as obtaining HPV and hepatitis B vaccinations. To summarize, is anal sex safe or unsafe for men and women? Unprepared, Unlubricated, rushed, or forced anal sex is physically unsafe and carries high risks of tissue injury and infection for both genders. However, when approached with patience, adequate lubrication, barrier protection, proper hygiene rules, and total responsiveness to the body's signals, anal sex can be engaged in safely by both men and women. Knowledge, clear boundaries, and medical safety protocols make all the difference. Thank you for tuning in. Prioritize your health, respect your body's limits, and see you next time.